Have you ever had to figure out for yourself what your baby feeding challenges were because you weren't getting the answers you needed from care providers? Today on the Milk Making Minutes, you will hear a story from someone who felt supported by the people she sought help from, but who also needed to do a fair amount of research and self-advocacy in order to meet her baby feeding goals. If she had not found answers to her struggles, there is no telling how her story would have ended up. And some people do just as much work and don't end up finding the supporters who give the right help. Or perhaps they are giving the right help, but for whatever reason, it just doesn't work out. So whether you did the work and ended up meeting your goals or ended up changing your plan, there is so much in this story that you can relate to. So enjoy.
When I began breastfeeding, I was blindsided by how difficult it was. I may have thought I was prepared, but having known only a handful of people who had ever breastfed and only seeing it up close from a couple of them, I had a huge learning curve. Since then, I've become a doula, a lactation consultant, and a childbirth educator. I'm your host, Lo Nigrosh, and I welcome you to the Milk Making Minutes, where we explore breastfeeding experiences through the lens of systemic barriers, so that you know your breastfeeding struggles are not your fault, and your triumphs really are the miracles you feel they are.
I am Tashery Reisner. I have one son. He is a little over 2 years old now, and he's still breastfeeding occasionally. And then my boyfriend and our dog as well. And I'm also a lactation professional myself. So,
yeah, great. Okay, so before we get into what feeding was like for you, tell me all about what your exposure was as you were growing up and then into your teens and your 20s.
Yeah, my exposure to breastfeeding, like growing up and coming into my adulthood and everything, was pretty much zero. I was the first person in my family on both sides, and probably like a couple of decades, maybe even a century. That's 100 years, right?
Mm-hmm.
Yeah. So in quite a few generations, I was the first person to breastfeed. I knew one or two friends that breastfed, but I never saw it in person or anything. They just talked about it. So I didn't really have any exposure to it other than like social media and like TV and all that kind of stuff before I decided to have a baby.
And so as you found out you were pregnant and preparing to have a baby, what was your thinking around baby feeding and how did you come to the decision to breastfeed?
I always knew that breastfeeding was better than formula because of all the things that formula just can't replicate to provide to a baby that breast milk does. So I always knew I wanted to maybe try it, but I wasn't sure like how to do it or anything like that. Pretty much I just knew everything that I had heard and seen on TV and stuff like that, heard from a few friends here and there. So I did a bunch of research on formula and breastfeeding and everything. And I decided that since it was the best route for feeding our child, that I wanted to at least try it and see if we could do it and go from there.
And did you have full support from your family, from your boyfriend? Was there any pushback at all? How did that go?
Yeah, I had full support from pretty much everybody. And as I was going through my pregnancy and like learning more about breastfeeding and stuff and getting ready to have my son, I actually learned that a lot more of my friends breastfed than I had realized. So I actually knew more people that had breastfed than I thought. I had a lot of support from friends, and my family was all supportive. None of them had ever did it, so they didn't really know anything about it, but they were all on board with it and everything. Yeah, we had a big support network. My boyfriend was supportive of it and everything. So that definitely helped on that aspect.
Great. So then knowing what you know now about how birth can impact baby feeding, do you want to give us a little synopsis of your first baby feeding experiences and how your birth might have impacted baby
Yeah,
feeding?
because we actually had, I call it an emergent induction
Mm.
because I had an induction scheduled for 41 weeks just in case he didn't come, because I knew at that point that's when the risks start to go up and stuff like that. Because I had wanted to try to keep our birth as natural as possible to have as minimal interferences with things like feeding and stuff. But we actually ended up going to the hospital because I thought that I was in labor and I wasn't, but he was having some heart rate fluctuations on the too high end, and then they were dropping too low and things like that. So they had ran some tests, and throughout the testing, they determined that he was possibly having some breathing issues as well. So they did not want to send us home and wait to see what happens, because I was only about 1.5 centimeters dilated when I went. And our amazing OB, she came in and she was like, "We're not going to let you go home, but we are going to get your baby out and make sure that he's safe and everything like that." So it was scary, but she helped ease our nerves in that aspect. And at that time, I didn't know all the things I know now about how births can affect your breastfeeding. So I wasn't aware that even just having an induction compared to going into labor naturally can really affect things. We had a fairly normal, I would say, labor and delivery. His first feed, we didn't get to do the breast crawl or anything like that because I actually didn't know about it yet. And he also had some oxygenation issues. So they had to take him away for a minute to stimulate him and get him to take those big, deep breaths. But as soon as they got him breathing good and they brought him back over, the nurses tried to help with breastfeeding, and they were like telling me how to hold him and like how to get him to latch and stuff. And I thought everything went well, and I thought he latched fine because he did latch and he was seeming to get milk and stuff. So everything seemed normal. It didn't seem like we had any issues. And as far as like our labor actually impacting anything other than just that first, like the timing of the first feed and stuff, I don't think it had any other negative impacts. I did end up with a big oversupply, but I don't know if that was from all of the fluids from labor and things like that, or if that was because of bad advice that I was following. But my milk did come in pretty quickly, I think on like day 3 postpartum or something like that. So everything seemed to be happening normally, despite the not natural labor process that we had.
Okay, great. And did you feel supported in the hospital once you had him to get going with feeding? Were the professionals that were there helping you, did they honor your autonomy and help you figure out how to feed while also treating you like somebody who um, was in charge of your own body and your baby?
Yes, our medical team was actually really great. I had actually made up a birth plan and I took it to one of my prenatal appointments. Me and my OB discussed it in detail and everything. She went over like every step and whether that would be something that they could do or not. So going into the labor process, they already knew that I wanted to breastfeed and that I did not want formula brought up or introduced at all unless it was absolutely like dire necessity. So they were all really supportive of that. They tried to follow every step of my birth plan as they could, including the feeding wishes. The only thing that I had a problem with, I guess I would say, is I never saw the lactation consultant. And I'm not sure if it was because I gave birth on the weekend, because he was technically born at 2 a.m. on Saturday morning. We were there for Saturday and Sunday, and then we were discharged on Sunday. So I don't know if she just wasn't working or if she was too busy or what the case was. But I did ask to see her quite a few times, and she never came. So yeah, that really upset me because I really wanted to make sure like we were doing things right and everything. But all of the nurses that we had and everything, they did the best that they could to help us and show us things. My one postpartum nurse, Bonnie, she was amazing. She got us nipple cream. She got us nipple shields. She actually showed me how to use the nipple shield too, because I didn't even know that they were a thing until she brought them to me. So she showed us how to use those and everything, helped us come up with some positions that would help. She was very helpful and supportive and knowledgeable for not being a lactation professional.
And were you experiencing pain? Is that why she brought the nipple shields?
She brought them initially. I honestly can't even remember why she brought them initially. I think we were having problems getting him to latch on one side. So that's why she brought them in. And then I ended up needing them because after almost 24 hours of nursing, my one breast, my nipple was so sore that when it came time to feed him that night, I looked at my boyfriend and I was like crying. I was like, I don't think I can do it. Like it hurts. And I know that part of that was just the newness of breastfeeding and being sore, but also we came to find out later that he had a tongue tie. So I think some of that played into it as well.
Yeah, absolutely. And I always tell people I work on a postpartum floor a couple of days a month, and I always tell people, although pain is normal in that a lot of people experience it, it's not normal in that you should continue to endure it. It's an indication that something is going on. So in your case, there was a tongue tie. So oftentimes as women in particular, we have been trained to just endure pain and to just grin and bear it.
Yep.
And especially when we have a new baby, we will make all sorts of sacrifices for this new baby, including bodily sacrifices. We've just gone through this traumatic experience of giving birth. And so we think, okay, this is just the next traumatic thing. I will endure all sorts of pain to make sure that my baby is well fed. But in the end, we should not have to endure pain to feed our babies. And I'm really sorry that the lactation consultant never came, because it's great that we can hand out things like nipple shields, and that's not really a long-term solution when somebody is experiencing pain or a baby won't latch. We really do need to figure out why that pain is happening. And so many people go home not knowing why they're in pain or why their nipples are getting damaged, because we just don't have enough support in the hospitals to help people resolve their feeding difficulties.
Yeah, because nobody told me that breastfeeding, there was some pain initiated, but it's not normal at that level. Nobody told me that. Nobody told me that I shouldn't use the nipple shields forever. None of those things. So yeah, I would have been nice to have seen the lactation consultant and have those things explained to me, because we just went home, okay, this is how it's going to be.
Exactly.
So,
right. Yeah, and even the lactation consultants in the hospital, we need to be really aware of helping people know what their next step should be, because once they go home, they're on their own. Make sure that people know, hey, you need to contact a private practice lactation consultant if you're going home with a nipple shield, because there needs to be some additional planning, because it's not typically a long-term solution. It's a way to get you going and get you started so that you can feed your baby right now, but it's not typically part of a long-term plan.
Yeah. And I know that now. Unfortunately, I didn't know that then. And I think we ended up using them for almost 2 weeks, because I didn't even get a phone call from the hospital lactation consultant until he was like 3 weeks old. And by that time, we had found out about the tongue tie, had it revised. We had used formula, like so many things. So
yeah. Yeah, and I totally can picture that night when you turn to your boyfriend crying, I don't know if I can do this. And so many people get to that point where they dread feeding their babies. And no one wants to be in that boat. No one wants to be dreading nurturing their baby.
Oh yeah. And it was hard. I felt bad as a mother, because I was like, I have to feed my baby, but I don't want to because it hurts so bad. And yeah, it was definitely hard, but he was supportive, and luckily it was only on one side that I had the severe pain. The other side wasn't as bad, so we were able to still feed him on the other side when that side was in pain.
And was that on that side, does your nipple look different, or is it differently shaped, or is it harder to pull out?
No, They're pretty symmetrical and everything. So I'm not sure why he had problems with that particular side. I don't know if it was just because of the tongue tie and being on that one side, it was just affecting it more or not. But yeah, he just always had problems with that one side until we got revised.
Yeah. Did he ever get any body work done after the tongue tie?
He did not, because I didn't know about any of that. The lactation professional that I had spoken to prior to his tongue tie revision, she didn't bring it up. And then the one that we had seen later on when he was around 2 months old, she didn't bring it up either. And neither did the ENT. So we never knew about it.
Yeah, you take each next right step as it comes, and you do the best you can with the information you have. So you get home from the hospital. You still haven't seen the lactation consultant. Were they saying she's not here, it's a weekend? Or when you were asking to see the lactation consultant, they were saying, okay, we'll send somebody?
They were basically just telling me, okay, we'll let her know. And then I just never saw her. So I have no clue why she didn't come.
Yeah.
It was mid-COVID too. It was February 2021. That could have played into it as well. Who knows? I never got an explanation.
Okay. All right. So you get home and you still have a nipple shield, and you at least have some nipple cream, and the nurse helped you as best as she was able, and you still have pain on one side.
Oh,
go ahead.
Oh, I was just going to say that we went home and we were just feeding like we were in the hospital.
And were there any weight gain concerns?
There was a little bit at first, because when we went home on Sunday, and I think we had to go back on Tuesday or maybe it was Monday, I don't remember, for his like 2-day checkup or whatever. And when we left the hospital, he had actually only lost like 3 ounces or something. Like, he lost a very small percentage. They were all impressed with that, because they said that normally babies lose around 10% of their weight and stuff like that. But they said lost like 6%. So they were really happy with that when we went home. And then at his first appointment, he was doing good still as far as weight went. I think he had gained a little bit. But then by that Friday, when he was approaching like 7 days old, we went, and he had actually gone down like an ounce or 2. So he was still feeding quite often. We didn't do any weighted feeds, because at that point I still hadn't seen a lactation professional, and I didn't even know about weighted feeds at the time either. So we didn't know how much milk he was actually removing. But we knew that he was getting milk. I knew I had a crazy supply. I was like super engorged, and I was feeding him all the time, and I was getting like an ounce or 2 with a haka on the other side. So like I knew that there was plenty of milk. But when we went to that appointment on Friday, they suggested to try supplementing after his feeds. So just feed him and then give him like an ounce or 2 of formula if he wanted it. Like, they didn't tell us to force it or anything. They just said if he wanted it. If he didn't, then we didn't have to give it to him. And then we would do that all weekend, and then we had to go back that Monday for a follow-up. And he had actually gained weight. We had went through, I just happened to have one of those like 32-ounce ready-made formulas that somebody had given us while I was pregnant. So we went through one of those through the whole weekend, and he had actually gained weight over the weekend. So they were happy with that. They said we could stop supplementing, but they weren't really looking into any issues. I had actually been the one to ask on the Friday appointment if they thought that his lip had a lip tie, because I thought he had a lip tie. I didn't know about the tongue yet. And so they wrote us a referral for the ENT for that, to get like a confirmation. And we had that appointment on Tuesday after the follow-up with the weight. So we went to that appointment, and his ENT was amazing. And he actually explained that his lip tie was not severe enough to cause any issues, and he would probably grow into it as he got older and stuff. It shouldn't ever cause a problem. But he did tell us that he looked in the rest of his mouth and he found a posterior tongue tie, which I had never heard about those. I had only known about the anterior with the front, which is typically what most people think of when they think of a tongue tie as well. He explained all of that to us and how that could be affecting his nursing and how that can later on affect like solid feeding and things like that as well. And he asked us if we wanted to have it revised there. So we did. And he let us nurse for, I think, like 15, 20 minutes. And then he came back in and asked us if things felt better, how he was doing. It was like an instant night and day difference nursing after he revised the tongue tie.
Wow.
Yeah.
So you were no longer in pain?
There was still a little bit of pain because I was so sore because he was only like, I think 8 or 9 days old at that point. But it wasn't, I could feel the difference in the latch. Like it wasn't as pinchy and things like that. So like I could just automatically tell that something was fixed that was causing a problem.
Wow.
Yeah.
That's amazing.
It was. And I was so relieved because I was like, oh, yay. Like, hopefully we don't have to deal with this pain any longer. So.
Yeah, that makes a big difference. We should not have to suffer through pain. So the fact that you were able to get that resolved so quickly after the tongue tie revision is pretty amazing.
Yeah, I was definitely happy because I didn't know that it was going to be that quick of a result. And like I said, I didn't even know that he had a tongue tie or that was an issue. So it was really nice having answers and results so quickly that day.
And he used scissors at the ENT?
Yes, he did use scissors. I don't know if they have a laser in that office or not. He never specified or asked if we preferred a method.
Yeah, my understanding is that typically at an ENT it's going to be scissors, and at a dentist it'll be a laser, but somebody can correct me if I'm wrong.
Yeah, I don't really know the difference. But yeah, he used scissors and there wasn't a lot of bleeding. I thought there was going to be, but it was a lot less than I thought.
And did he give any guidance on aftercare, what you should do to care for his tongue?
Yes, he gave us some instructions on finger stretches and stuff to do for, I think he said like a week to 2 afterwards, just to make sure that the scar tissue doesn't heal back.
Was that difficult to do?
It wasn't as hard as I thought it was going to be. It was still hard because you have to shove your finger in an infant's mouth, but it was not as hard as I thought it was going to be. Parker was actually really cooperative for the most part.
Yeah, yeah. And how frequently did you have to do that throughout the day?
No, we did it twice a day, I think. He had us doing it. Some days we forgot and only did it once, but we didn't have any issues with any scar tissue forming back or anything like that.
Yeah. This is another part of tethered oral ties that is highly controversial and that changes from provider to provider. So I like to hear what different providers say, because some people say, don't do anything. And some people say, do the stretches 10 times a day or every 2 hours. And some people say, do them for a week. And some people say, do it for 2 months. So it's really variable what the aftercare looks like. And it's so understudied that it's really hard to know what is the evidence-based information to give. And probably different babies are going to need different aftercare instructions. Anyone who is thinking about getting a tongue tie corrected, they may need to just tune into their baby and say, is the scar tissue looking good? And base what they do off of their individual baby.
Exactly. Every baby's different. Everybody's body heals differently. So yes.
Yeah.
Definitely follow your baby's lead on what you need to do.
You had worked with an IBCLC before you saw the ENT, or not until after? Because you've mentioned seeing a couple of IBCLCs.
I spoke to a CLC. I reached out to her probably, I think it was probably Friday after we got the formula supplementation instructions. And I just talked to her throughout the weekend, and like any questions I had, like I asked her and stuff, because I had questions about like how to feed him and when to feed him, because they were just like, oh, 20 minutes on each side and every 2 hours, blah, blah. So I was like, okay, am I supposed to be like am I supposed to do 20 minutes and then stop and then switch to 20 minutes on the other? Because that's what I had been doing for his first like week and a half of life and everything. So I reached out to her with all those kind of questions that I had about like his weight gain and the formula and like how to feed him and stuff. And she was really knowledgeable. She was still going through the process to become an IBCLC, but she was a CLC. So she sent me like resources on what like normal weight gain looked like. And like she told me how to feed him and like just to let him unlatch himself and just follow his lead and stuff. And because I was a mess, honestly, when I messaged her. I was like, they just told me all this stuff and I don't understand it and everything. And am I supposed to do it this way or am I supposed to do it that way? Because like I take things very literally because I have a little bit of autism. So like sometimes when people explain things to me, I'm like, okay, I have to do it exactly this way because that's exactly how they said it. And that's how I was feeding him with the like 20 minutes per side and stuff. And she was like, no, you don't have to do that. Just put him on one side and let him feed. When he's done, you can offer him the other side. If he wants it, great. If he doesn't, it's fine. And then next time, just start on that side. She made it very simple and easy for me to understand, and like really helped me feel a lot more comfortable after realizing we were having these struggles and stuff. And then I spoke to an IBCLC when he was 2 months old, so way after the tongue revision.
And that was just on the phone as well?
No, the first one was on the phone. The second one, she actually came out to our house and did a weighted feed and watched us nurse. She checked his revision to see how it was healing and everything. So that one was a lot more in depth.
Okay. And how did you feel after seeing her?
I felt really good after seeing her because after we got the okay to stop formula feeding and he got the tongue revision and he started like gaining weight and stuff, I still just felt like I didn't know what I was doing and things like that because I still hadn't actually seen a lactation professional in person yet. So I really felt like that was something that was going to help us to keep breastfeeding. And so I went on the Lactation Network and was able to find one in my area that could come to us.
Yes, great.
Yes.
That's great.
Oh, yeah. And because we actually lived in the country too, like outside of the city. So I was like, I don't even know where to find one out here without having to drive like an hour into the city to go see one. So it was definitely wonderful. The Lactation Network made it very easy to find her, and she came out and was really awesome. She was very nice and knowledgeable and made us feel really comfortable. And I think if it wasn't for those two women, we probably wouldn't still be breastfeeding at 28 months old.
As you hear from Tashery's story, working with a lactation professional really can make or break your breastfeeding experience. So wherever you are in your pregnancy or breastfeeding journey, if you are now considering working with a lactation professional and you would like to work with me, I would love to be the person who helps you figure out what your initial goals are or helps you figure out what your next right goal should be and helps ease your mind and your worries about how you get there. I can work with you virtually or in person, and in many cases, I can bill your insurance directly. And if for some reason I can't, I can provide you a super bill that you can present to your insurance company for reimbursement. So go to my website, www.quabbinbirthservices.com, to learn more. I can't wait to work with you. So that was about 2 months postpartum. And so anything else that came up in your 28-month journey so far?
We've had quite a few things. We've had probably close to 20 milk blisters. And then I've had mastitis like 4 times.
Oh
And
my
I've,
God.
yeah, and I've probably had 12 clogged ducts. We've had a lot of issues,
Oh,
but we've just kept chugging along and just keep going. So it's to anybody who does have a lot of issues around lactation. If you want to keep feeding, it's possible. As somebody who has had plenty of issues, I haven't had any of the severe ones that I've heard other mothers have had, but I've still had lots of issues along the way, and we're still going. And I don't know when we're going to stop. We're doing the baby led weaning on it. So we'll see when he's ready to be done.
yeah. So you mentioned that you had oversupply, which is probably why you've had mastitis so many
Oh, yes.
times and the milk blisters. So tell me, how have you dealt with the oversupply? And then what was the care like when you did get the mastitis, and how did you care for the milk blisters?
The oversupply, I didn't realize I had an oversupply until I was like months into feeding, and I was like, I have thousands of ounces of milk. And I like was watching videos on TikTok, and I was like, this isn't normal. So I clearly have an oversupply. And I didn't do anything to regulate it. We actually moved when my son was around 5 months old. And then about a month and a half after that, it slowed down and started to regulate itself. Like it cut itself in half. Like my supply dropped hard around 6 months. And I was really sad about it at first. But then I was like, you know what? We have all this extra milk and he's not drinking it. So like it's fine that my supply dropped. And then as I started realizing that it was an oversupply, I was like, this is now probably just what a normal supply is like. And so I ended up donating milk to a bunch of women to feed their babies. And I learned too, like throughout the oversupply process, that I actually was probably the reason for my oversupply. Some women just naturally have an oversupply, but I don't think that was my case, because I was following the popular trend on TikTok that I had seen at the time, where everybody was telling women to latch their baby on one side and then take your haka and suction it to the other side. And having not seen a lactation consultant or anything, and social media, if it's on the internet, it must be true and stuff like that. So I was like, okay, I want to save all that milk, but I didn't realize that when you use the haka with the suction, you're actually using it like a normal pump. And so I was telling my body that I was feeding two babies at the same time when I wasn't. So after I learned about that, I stopped using my haka while I was feeding. And that actually helped lower my supply, I believe, a little bit too. And just over time, it's gradually leveled out. I stopped leaking milk all the time and stuff. Like I woke up one morning and like my whole bra was soaked. My milk pad was like dripping. It was crazy. I was like, oh my God. Like at first I thought somebody had popped my boob. I was like, oh my gosh. But once it regulated and got normal, everything like got better. We only had a few milk blisters after that. And I believe that could have been like positioning and way that we were feeding, because it was always on the same side and I was always feeding him in like the same position on that side and stuff. And so I did research as we were coming up with all of these clogs and milk blisters, and I learned that could be a cause of clogs and milk blisters is feeding on the same side and a lot of like compression and stuff, because we were side lying and I would always feed on the one side that we were laying on. Every now and then I would roll over, but if we were in bed, it was almost always the one breast. I was like, that's probably what did that. So we started switching sides and making sure that I wasn't like laying on that one side all the time and things like that. And that helped prevent those blisters and things as well. And as far as the care for the blisters and the mastitis, I just did a lot of heat and breast massage. I did a lot of trying to pump it out. I think the first time that I had mastitis was probably the worst time that I had it. And that was actually when he was about 2 weeks old. I had slept through a feeding because my boyfriend had woken up and taken him and fed him a bottle. And so I just slept for 4.5 hours. And then I woke up and I was like, oh, like gorge, I gotta feed the baby or pump or something. So I got rid of some milk. And then a few hours later, I had a warm spot on my chest and it was like itchy. And I didn't really think anything of it because I have dry skin and stuff. So I was like, maybe I just have a little eczema patch or something. But it started to hurt as the day went on. And I was actually out grocery shopping with my son and I was baby wearing him. And I was like, I feel like I have a fever. Like my whole body hurt. I was like chills, cold. I just remember like it was so hard to push the grocery cart through the store. And I was like, something's not right. So we hurried up and finished shopping, went home, and I was like doing research and I was like, I think I might have mastitis. So I called my doctor and she called in some antibiotics and stuff. And luckily there was like one 24-hour pharmacy left in the middle of COVID. So I was able to get some antibiotics at 10:30 at night. And after I started those, like it started instantly clearing up. So that's the one thing I find so crazy about mastitis is it comes on so fast. And then once you start treating it, it clears up so quickly as well.
Yeah. And then you got it 3 more times after that?
Yes. But they weren't as bad. The clogs were not as severe. And I didn't get the feverish symptoms and things like that with it. So I actually didn't even need antibiotics for the last 3 times. I was able to just work it out on my own.
Okay. Wow. Yeah. Mastitis is no joke.
No, like I said, I was so surprised because it all happened so quickly within maybe a 6-hour, 7-hour time period. I went from like feeling perfectly fine to feeling like I had just been smacked with the flu.
Yeah. Yeah. That's really difficult, especially when you're just 2 weeks postpartum. And
yes.
You're recovering from so much to begin with.
Yes. But thankfully, my OB was wonderful and was able to get those antibiotics called in for me.
Yeah, it's nice that she believed you and you didn't have to go to an appointment, get looked at, that she was able to just send it in.
Yes, because we were trying to find a way to get me to get an appointment the next day, but they were like all booked up. And I think it was close to the weekend because I just remember it like telling her like, I can't wait a couple of days. And she asked me a whole bunch of questions like, do you feel this and this? Do you have a fever? All that stuff. And I was like, yeah, definitely. I have all of it. So she was like, okay, I can just call in some antibiotics for you then.
Is there anything else about your experience that you think it's important for people to hear?
Yeah, there's a couple of things. I always tell mothers, if you have a lactation issue, please go to a lactation professional. Your pediatrician or your OBGYN or your family doctor, they know a little bit about breastfeeding, but unless they're attending the courses and trainings and things that we're attending day in and day out all year long, then they're not going to be up to date on everything. And so they're not going to have the best information and they probably won't be able to help you because I don't know how many doctors told me, I don't know, when I asked them a breastfeeding related question in my son's first year of life, because I had to have a surgery and I had to have a radioactive procedure to confirm that surgery. And so many doctors were like, I don't know if you can breastfeed after being injected with this radioactive material. And I was like, that's wonderful. Thank you so much. So if you have breastfeeding questions or problems, go to a breastfeeding professional. And then the other thing that I like to tell mothers is breastfeeding is not supposed to be painful and hard like everybody makes it out to be. And so if it is, then you probably have a problem that you need to seek help for. Because I hear so many mothers say, it was so hard and it was so painful, I just gave up, or I didn't know who to talk to for help. So I just switched to formula because it was easier. And so many mothers are sad and beat themselves up because they feel bad that it was too hard and they couldn't keep going. So if you feel like it's too hard or it's too painful or something, reach out to your lactation professionals because they can help you and they can make sure that you breastfeed as long as you want to. Because myself and my son are absolute proof of that. Without our lactation professionals, we probably would have stopped at 6 months, if that.
Yeah. And if you aren't able to meet your goals, whether you've met with a lactation professional or not, it is not your fault. It's a systemic problem.
Yes.
So you can just know that you did the best job you could with the information you had.
Yes.
So both things are true. We are here to help you. And if you didn't get the help you needed, or you sought out the help and it still didn't work out because we can't solve every problem, we are still proud of you for the work that you did do. And
yes.
You are still a good parent.
Yes. That I am so proud of any mother who even just tells me that they breastfed just for the first feed. I'm like, that's fine. That's wonderful. That's the most important feed to breastfeed your baby. So that is great because you did what you wanted and you fed your baby how you wanted the information that you had.
Awesome. Where can people find support from you?
They can find me on TikTok and Instagram and Facebook. I am the Boobie Whisperer, Boobie. And I try to post on there as often as possible, usually at least 2 to 3 times a week. And they can always message me with questions, or you can book appointments right there on my Facebook. And they come right to my phone like instantly, so I can confirm it immediately for you. And I do virtual consults. And for hands-on in-person visits, I'm available in the Northwest Ohio area.
That's great. Awesome. Thank you so much. We'll have all of your information linked in the show notes as always. And thank you again for being willing to do this interview over. Your story is important and I value your time and I appreciate you telling it again.
Oh, yes. Thank you so much for having me again. I love telling my story and love letting mothers know that you can do extended breastfeeding and you can keep going even when you have lots of problems. And if your pediatrician tells you you have to supplement, it doesn't have to be forever. We only did it for 3.5 days. So it doesn't have to be forever. And just if it's what you want, there are people to help you achieve that.
That's right. Awesome. Thank you so much.
You're welcome.
If you really want to feed your babies human milk, it is really important to get help from the people who know how to do this. Breastfeeding has become a lost art form. Just like Tashery mentioned, she was the first person in her family in maybe a century to feed a baby from her own body. And that has meant we have lost breastfeeding culturally, which is why we need to rely so frequently on lactation consultants and other professionals to help us know how to feed our babies. And often providers like pediatricians and nurses don't know what they don't know when it comes to baby feeding. And while I deeply respect pediatricians for the knowledge that they do have, what I know is they have to study and understand such a wide-ranging array of topics because they are dealing with so many things that could go wrong with your baby from the moment they're born until they become adults. And baby feeding is just not one of the areas that they become experts in. And so if you are looking to understand how to improve your situation with baby feeding and you do not have people in your life who are really helping you do that on a personal level, then reach out to people who really can. And you know what? If you reach out to somebody and you have a conversation and you feel like this isn't the right person for me, then find somebody else. And with that being said, I would love for you to join my Milk Making Minutes community group on Facebook. It's a place where both parents and professionals come together to discuss the inequities that make feeding our babies human milk so difficult. And if this podcast has meant anything to you, can you please rate and review it on your preferred podcasting app? That goes a long way in helping future guests know that it is worth their time to come here. And I'm really hoping to get some big guests on in 2023. Thanks. Bye.